Hi, I'm David Gottenborg, chiropractor here in Pelican Rapids, and I thought an interesting subject today might be tendonitis. And so if people have heard of tendonitis, what it really is it's either an inflammation or an irritation of a thick cord that attaches the muscle to a bone. And some of the more common symptoms might be localized pain or swelling, or tendonitis might start to limit the flexibility or movement of a joint. Causes vary from things like repetition or minor impact, a minor injury. It might have a lot to do with the posture or the alignment of a joint. And then again, it might have to do with an abnormal position or placement of a bone or joint. For example, things like differences in leg length or underlying arthritis. These things can all start to cause irritation on the supporting connective tissue. The most common sites can be found in our extremities, like the knee, hip, elbow, and shoulder. Maybe you've heard of the word tennis elbow or golfer's elbow. In fact, sometimes when the condition is allowed to occupy the shoulder too long, it actually forms an adhesion, and this is when doctors use the word frozen shoulder. And so what we try to encourage people that we come into contact with is, if you begin to have pain in a joint or notice swelling, or when moving a joint you begin to hear a crepitus or a grinding-like sound, that is the best time to seek intervention. And a lot of things that you can do at home is, for example, is certainly stop the repetitive activity. Icing is excellent. Resting the area and bracing the joints. So there are different types of braces or straps that you can find that help support the joint. It's still a good idea to visit with a doctor or a chiropractor as far as how to place the band or strap so it's not too tight and in the right place. So let's say you choose to seek some type of a care. Medically, what appears to me is that the options a lot of time are rest, something for pain, and what seems to be very popular today is cortisone, which I believe that if applied or received more than 1 or 2 times is actually caustic and lengthens the duration of the problem. People may choose to see physical therapists who use different types of therapies to try to alleviate pain. Chiropractors, I think, while we can provide these same services, we also take into consideration the effects of joints above and below the injured site as to how do they affect the pain. For example, with the hip, we may look at differences in leg length, and we might not only look at the knee, the foot and ankle, but also the low back and pelvis. Definitely for the shoulder, other than just simply treating the shoulder, I would look at the elbow, the position of the shoulder blade, the sternoclavicular joint, and the AC joint. So I think rather than just doing something to provide relief, that in the very end we want to improve posture, structure, and alignment. And I think this is when people get well very quickly. In the event that you're having pain or have heard that word tendonitis, feel free to contact us here in Pelican Rapids. It may be just advice on how to tape a joint or brace a joint so it's the most effective. Thank you.
Thank you for watching Wellness for Life.